Hey, Sarah. I wanted to chat with you about sedation and analgesia in the hospital setting. It's a crucial aspect of patient care that requires careful management.
Absolutely, Dr. Patel. Sedation and analgesia play a vital role in relieving pain and anxiety, promoting patient comfort, and facilitating various medical procedures.
Let's touch upon some key points. Sedation and analgesia should be tailored to each patient's unique needs, taking into account factors such as age, comorbidities, medication history, and level of consciousness. The primary goals are to achieve adequate pain relief, minimize discomfort, and maintain patient comfort while ensuring safety and preserving respiratory function. Various medications are used for sedation and analgesia, including opioids, benzodiazepines, and propofol. The choice of agent depends on the desired level of sedation, patient characteristics, and the nature of the procedure. Regular monitoring of sedation levels, respiratory status, hemodynamic parameters, and pain scores is essential to ensure patient safety and optimize therapy. Continuous assessment allows for timely adjustments and interventions as needed. So, Sarah, those are some key considerations when it comes to sedation and analgesia in hospital patients. By providing effective and individualized therapy, we can improve patient comfort and enhance overall care outcomes.